morning, students. It's Dr. Daley. It's really nice to connect with you. I'm definitely missing seeing many of you and seeing you walking around the halls here at the College of Medicine. I wanted to check in with each of you. A video seemed like the best opportunity given the current circumstances. So I'm hoping to take some time today to talk with you about a few specific things. So managing and recognizing your emotions, how you can maintain health-promoting behaviors, which are so critical during this time, recognizing changes in your mental health or signs that your mental health might need some intervention, and then also I want to end with a mindful meditation. So the first thing I'd like to talk about is emotions, so how you can take care of your emotions. I think it's really important right now during all this to recognize that you may be experiencing more emotions. That's completely normal. You're going to have good days, you're going to have bad days. So recognizing things like when you're feeling grief or experiencing grief, anxiety, sadness, anger, hopelessness, and just sort of being aware of what you're feeling. So I encourage you to check in with yourself. Like, how am I doing today? Whether you do that at the beginning of the day or at the end of the day, it's a very ripe time for journaling or keeping a record of how you're feeling. And then to remember to exercise self-compassion, so to be compassionate for yourself as well as for others who might be feeling heightened emotions. So things like, perhaps you had a really strict goal of what you wanted to accomplish in terms of step studying, but if you're having more anxiety and fear that day, to give yourself permission to know that it was not a good day emotionally and that you took care of yourself and did what you needed to do, because we're all doing our best in this epidemic. The next thing I want to talk about is health-promoting behaviors. I talk about this all the time with you guys. I'm a huge believer in it. It is so essential, especially during this epidemic. It's so essential that it's even incorporated into the shelter-at-home orders, that exercise is still permitted and encouraged. It's good for your mental health, it's good for your physical health and immune functioning. So I encourage you to keep exercising, whether you're switching to outdoor cycling, running, walking, to use those at-home exercise apps, to be mindful of your nutrition. So things like recognizing maybe a resurgence of past disordered eating behaviors. So if you're binging more or restricting more, to kind of be mindful of that and make sure that you make healthy nutritional choices to nourish your body during this time. Also to protect your sleep. This is something that we talk about a lot here, is how you can use good, healthy sleep hygiene tips. These are really important during this time because people are reporting more nightmares, insomnia, and that's a normal reaction, but I want to encourage you to use those healthy sleep hygiene tips, which I'll send out in a separate flyer, so that you can kind of preserve getting a good night's sleep. And then lastly, managing your stress, which can be done through time with an animal, can be done through leisure activities like reading, taking a walk, staying connected to friends and family through Zoom, through FaceTime. That is so important to get that contact, even if you can't have it in person right now. And I think it's important to distinguish between text messaging or those types of apps versus actually talking or communicating through something more kind of interactive like FaceTime, which I think gives more of a sense of connection. And then the last thing I want to talk about is your mental health. A lot of people have common mental disorder symptoms, so anxiety, depression. Those are not uncommon in medical students to begin with, especially when we look at the timing of this epidemic. So step one, it also occurred around match and preparing for residency, the end of the M1 year, which is a busy time, and while our third year students are in clerkship. So just being aware of your mental health symptoms, your anxiety, your depressive symptoms, sleep. And I think it's really important to recognize if you're noticing changes in your mental health, if you're having suicidal thoughts, if you're feeling hopeless or depressed, and if it's not getting better, that I'd encourage you to reach out to me. I'm still meeting with students via Zoom. I have a cell phone that the number has been provided to all of our med students in a separate email that came out from Soraya and Casey. So feel free to reach out and stay connected. You don't want your mental health to be neglected during this time. And then lastly, I want to end with one of my favorite things that I love to do with you guys, which is a mindful meditation. I'm missing seeing all of you. I'm missing seeing close friends and family, and one of my favorite places to go is the beach. I love being outdoors at the beach. It's an opportunity whenever I'm feeling overwhelmed to kind of hand my problems back to the ocean. So I hope that you'll enjoy kind of joining me in a mindful meditation where we can imagine that we're going to the beach together. Well, I hope you enjoyed that. It's been really nice reconnecting with you, even though it's through technology. Again, I'm looking forward to when we all get to be together again. Thank you.